So friends, we are here with the new topic, that is the leukocytosis and leukopenia. So in the first hematological lecture, we talk about the anemia. It is regarding to the RBC and the hemoglobin. Now we are talk regarding to the WBC. So you all know WBC plays a crucial role into the immune system, right? So abnormalities in their count are indicative of the various physiological and the pathological condition, right? So basically there are the five types of the WBCs. White blood cells are there, first they are the neutrophils or the polymorph. They are the 50 to 70 percentage. Lymphocytes 25 to 35 percentage. Eosinophil 1 to 3 percentage. Monocyte 4 to 6 percentage, and basophil 0 to 1 percentage. So let's see what are the objectives of the today's lecture. So after the end of the session, you must know what is the definition of the leukocytosis and the leukopenia, which are the different etiology of the leukocytosis and leukopenia, which are the differential diagnosis of the leukocytosis and leukopenia, which investigations are useful to determine what may be a cause of the leukocytosis or the leukopenia, and which are the management, including homeopathic management of the leukocytosis and the leukopenia, right? So let's see the first one, that is the leukocytosis. So leukocytosis refers to an increase in the total white blood cell above the normal upper limit, typically more than 11,000 cell per cubic mm, right? So normal value, that is the 4,000 to 11,000 per cubic mm, right? So you did the practical into the first BHMS, you did the differential count, and you WBC count into the Newberg chamber, right? So if it is a more than 11,000 in adult per cubic mm, you may say that is the leukocytosis. Basically, leukocytosis means increase in the total white blood cells. Remember one thing, increase in the total white blood cells, which we consider that is the leukocytosis, right? Now let's see what are the etiology of the leukocytosis. So etiology of the leukocytosis are divided into the two part. There are some physiological causes and there are some pathological causes. So let's say physiological causes first. Exercise. After the exercise, leukocytosis is common. Emotional stress, pregnancy, postprandial state, खाना खाने के बाद, और the newborn period. ये बच्चा जब पैदा होता है, जन्म होता है बच्चे का, उसके बाद का कुछ समय वो leukocytosis रहेगा, because it is a most crucial role it has a regarding to the immunity, right? Now let's see what may be a causes, etiology of the pathological causes of the leukocytosis. So first pathological cause, that is the infections of the bacterial like a pneumonia. In the viral, in the early phase there will be a leukocytosis, but into the advanced stage, into the viral infection, it will be a leukopenia, right? Parasitic infection like into the malaria, there will be a leukocytosis you may found. Some inflammatory condition, inflammation hai, so like rheumatoid arthritis and the inflammatory bowel disease, you may found there will be a leukocytosis without any infection, right? Other, there are the hematological disorders like leukemia, especially chronic myeloid leukemia, and the myeloproliferative disorders. So in these three pathological cause, like infection, inflammatory conditions, and the hematological disorders. So apart from these three pathological causes, some miscellaneous causes of the leukocytosis are also there. So let's see which are the different miscellaneous causes. So that is the first, that is the drugs. Drugs like a corticosteroids, which can increase the white blood cells. Lithium, the medicine which is used full in the treatment of the mania. Epinephrine we can use into the allergic condition, right? And the tissue necrosis, when the tissue is a necrose at that time, also WBC can be a rise. So in the case of burns, in the case of myocardial infarction, and in the case of trauma, so these all are the different etiology or the causes of the leukocytosis, right? Now आप सबको बताएं कि total count बढ़ जाएगा, we can consider that is the leukocytosis, right? But specific type base, which specific white blood cell is increased in which disease or in which condition, right? So let's see type based on the predominant WBCs. So first, that is the neutrophilic leukocytosis. In this case, the neutrophil, only the neutrophil will be increased, right? So at that time you may consider that is the bacterial infection. Second, that is the lymphocytic leukocytosis. Lymphocytes are increased, you may consider that is the viral infection. Eosinophilic leukocytosis, only eosinophil will be raised, it is considered that is the allergy or the parasitic infection. If that is the monocytic leukocytosis, so you may consider that is the tuberculosis or the chronic infections. And the last one, that is the basophilic leukocytosis. So it is considered in only and only myeloproliferative disorders. So we are talk regarding to the leukocytosis. So leukocytosis means the total WBCs 4,000 to 11,000, right? When it is increased above the 11,000, you can consider that is leukocytosis, fine. But when we do the differential count and we check the differential count, so in the differential count, you know that is the neutrophil, lymphocyte, eosinophil, monocyte, and the basophil, right? So any one will be increased. एक साथ सब तो नहीं बढ़ेंगे, कोई भी एक बढ़ेगा, right? So if that is the neutrophilic, lymphocytic, eosinophilic, monocytic, and the basophilic, right? So I hope you can easily understand. This thing is a very helpful when we make a diagnose on just only on basis on the CBC report, right? So CBC के ऊपर से ही आपको क्लियर पिक्चर पता चल जाएगा कि ये वायरल इन्फेक्शन है या बैक्टीरियल इन्फेक्शन है या कोई एलर्जिक कंडीशन है या कोई क्रॉनिक डिजीज है या क्रॉनिक कंडीशन है, right? So I hope you can easily understand what is the leukocytosis, right? Now let's see what is the leukopenia. So leukopenia is a reduction in the total white cell count below the normal lower limit. So normal lower limit, you know, that is the 4,000 cell per cubic mm, right? So cells are goes less than the 4,000 cells per cubic mm. We can consider that is the leukopenia, right? हमें ये पता चल गया आपको, right? Now let's see what may be etiology of the leukopenia. So first thing, that is the decreased production decrease हो गया है. So it is regarding to the bone marrow, right? So aplastic anemia or the bone marrow suppression. Bone marrow suppression किस चीज से हो सकता है? Either radiation or the chemotherapy or the myelodysplastic syndrome. बढ़ जाएगा myeloproliferative syndrome, घट जाएगा myelodysplastic syndrome, right? Second cause, that is the increased destruction or the sequestration. Okay, destruction हो रहा है WBC का. So it is happening to the autoimmune disease like a systemic lupus erythematosus SLE or the hypersplenism. तो spleen अपने आप से ज्यादा काम कर रहा है, right? Some infection are also causes the leukopenia like a viral infection, especially AIDS, acquired immunodeficiency syndrome में HIV human immunodeficiency virus, hepatitis, measles, right? Typhoid fever. Typhoid is happened by the bacteria, right? But this can causes the lower WBC, and the tuberculosis can causes the leukocytosis, but miliary tuberculosis can causes the leukopenia. So these two things always don't be misguided in this thing. In the typhoid fever, there will be a lower level of the WBC, and into the miliary tuberculosis there will be a lower level of the WBC. Right? Now let's see other etiology of the leukopenia. Nutritional deficiency. So in this case, vitamin B12 and the folate, these are the raw material of the erythropoiesis. So if they both are the lower, so RBC भी डिस्ट्रक होगा और RBC भी नहीं होगा, एनीमिया भी होगा और साथ में ल्यूकोपेनिया भी दिखाई देगा. Right? Now some drugs like antipsychotic drugs, clozapine is used to treat the schizophrenia. Right? Some chemotherapy agent and the antithyroid drug like a carbimazole or the profile thiouracil. This drug can causes the leukopenia. So same, they are the miscellaneous causes of the leukopenia. Right? Now let's see same like a leukocytosis type based on the WBCs. So in the leukocytosis we talk neutrophilic leukocytosis. Now here you can say directly that is the neutropenia. So neutropenia is the most common. It is happen into the viral infection, right? Most common condition, right? And that is the increase the risk of the infection, because remember one thing, neutrophils are the first line of the deficient soldier, first line soldiers. Second, that is the lymphocytopenia. It is seen into the HIV and the steroid. Eosinopenia. It is seen into the Cushing syndrome or the acute stress. राइट. अब बात होगा बाकी रह गए तो मोनोसाइट और बेसोफिल, वो तो ऑलरेडी कम होते हैं. राइट. नाउ द पेनसाइटोपेनिया सब कम हो गए हैं. सो इट इज एसोसिएटेड विद द बोन मेरो फेलियर. Right? So I hope you can easily understand which are the different types on the WBC deficiency. Right? Now let's see what are the differential diagnoses of the leukocytosis. So category और possible cause में हमने टेबल बनाया हुआ है इधर. So if that is the infection, so possible cause bacterial, pneumonia or the abscess is there. Right? इसमें आपको ज्यादा कौन सा बड़ा हुआ दिखेगा? न्यूट्रोफिलिक ल्यूकोसाइटोसिस दिखेगा. Hematological causes like leukemia or the lymphoma. Inflammatory causes, rheumatoid arthritis or the SLE or the drug induced, they are the steroids. Right? So I hope you can easily understand what are the differential diagnoses of the leukocytosis. Right? Now we move on the differential diagnosis of the leukopenia. So in the leukopenia, the viral infections, possible cause, they are the HIV or the influenza. Right? It is a common H1N2, H1N1 swine flu, H1N2 influenza. Bone marrow failure like aplastic anemia. Nutritional deficiency, B12 or the folate deficiency. Autoimmune condition like SLE. And the drugs like antithyroid drug and the chemotherapy. Right? So my friends, I hope you can easily understand what are the differential diagnoses of the leukopenia. Now move on the investigations. Which investigations are useful to find the what may be a cause of the leukocytosis or the leukopenia? So अभी मान लो सबसे पहले ल्यूकोसाइटोसिस है कि ल्यूकोपेनिया, we have to do the basic investigation. We are going with the CBC to determine the WBC count or the differential count, total count, इसको short form में बोलते हैं TC and DC, right? Total count as well as the differential count. We got what is the picture of the body, right? Second, we have to perform the peripheral smear. So from the peripheral smear, we may know the what may be a morphology of the WBCs, right? Or if we can't got what may be a cause, then we go with the further investigation on the basis of the suspected cause. We already learned about the suspected cause into the previous slide, right? So first, if you think bone marrow, then bone marrow aspiration or the biopsy. If you think the deficiency, we go with the vitamin B12 or the folate level. If we think there are any infection, viral infection, we have to perform the serology. right? Culture to rule out the infection, right? We have to do the viral panels like RT-PCRs for the COVID, or we can perform the RT-PCR for the dengue, or many RT-PCRs for the viral infection, right? Where we have to perform the autoimmune panel, anti-nuclear antibody, right? Then the HIV, hepatitis serology. फिर भी पता नहीं चलता है, then we go for the chest x-ray to rule out the pneumonia or the any inflammatory condition into the abdomen. We have to perform the ultrasonography of the abdomen. So these are the basic investigations to rule out what may be a cause of the leukocytosis and the leukopenia. Now let's see what is the management of the leukocytosis. So first, treat the underlying cause. If there is infection, give the antibiotics, appropriate antibiotics, limited use of the antibiotics. Antibiotics are not just like again chana mumra nathi, right? We have to give the cautionly. Second, that is the if there is a leukemia, we can give the chemotherapy or the targeted therapy by the oncologist. And if we found there is some drug is responsible for the leukocytosis, we have to discontinue that specific drug. Right now, let's see what are the causes of the leukopenia, management of the leukopenia. So first, treat the infection promptly, because in this condition, the patient is in the immunocompromised state. उसकी immunity बहुत कम है. So हमें cautionly और the promptly infection को treat करना है. If deficiency, we can give the B12 or the folate supplements. ऐसी ड्रग को अवॉइड करना है जो बोन मेरो को सप्रेस करती है और द इरिथ्रोपोएसिस को सप्रेस करती है. अवॉइड द माइलोसप्रेसिव ड्रग्स. एंड if there is a neutropenia, severe neutropenia, then we give the granulocytes colony stimulating factors GCSF हम दे सकते हैं, but only and only in which case when there is a severe neutropenia, right? So I hope you can easily understand what may be a management of the leukocytosis and leukopenia. Now let's see what are the homeopathic therapeutics, right? So homeopathic therapeutics for the leukocytosis. So belladonna, high fever, sudden onset of infection, there will be a congestion, right? But remember one thing, when you select the homeopathic medicine, take the full case, consider the totality of the symptom, constitution, miasm, and the repertorial analysis, and then we have to give the medicine. But this is the therapeutics. Just we have give the therapeutic basis the medicine. Second one, pyrogenium. In the pyrogenium, sepsis, foul discharge, high pulse temperature discrepancies, right? Third one, that is the mercurius solubitus. Suppurative conditions, profuse sweat, offensive odor. Other is the hepatosol, abscess formation, suppuration tendency. These all drugs are to use the treatment of the not a specific leukocytosis. Remember one thing. But we have to use this drug to treat the cause, which can cause is the leukocytosis, right? Now let's see what are the homeopathic therapeutics for the leukopenia. So first, arsenicum album. In the arsenicum album, prostration, recurrent infection, anxiety is there. China officinalis, recurrent fever, weakness due to the blood loss, ferrum metallicum, pale, anemic patient, weakness, desire for rest, calcarea fos, bone marrow weakness, failure to thrive, and the last one, that is the natrum for the grief, anemia, emaciation despite the good appetite. So these are the homeopathic therapeutics. But once again, a request to you, you have to take the full case, you make the totality of the symptom, then you have to consider the medication, right? Now, last key points to the remember or the summarize. Remember friend, leukocytosis and the leukopenia are the key indicators of the systemic illness and require a comprehensive clinical evaluation, and the homeopathic remedies when it is a well selected, it can play a supportive role into the improving the immunity and the general health into the affected individuals. So my friend, I hope you can easily understand what are the today's objective. So you must know, you may know about the what is the definition of the leukocytosis and the leukopenia, what are the etiology of the same, what may be a differential diagnosis, and what can we do the step as a management for these two things, right? So thank you very much. If you have found any query or if you found any question, please feel free to ask me as a comment or directly. Thank you very much.